Right, so you're welcome back to the AM show, and thank you very much, Oroku, for bringing us sports. Now, this morning on the AM show, we're talking mental health, and we'll be doing that in a bit, and how much, very little attention is paid to that mental health, even though about 13% of Ghanaians may be walking about with some mental health issues. We'll be getting to that discussion, but before then, Joy News has uncovered, investigations has uncovered how some staff of the Ghana Revenue Authority and aid businesses bidding for contracts to circumvent laid down procedures in the acquisition of tax clearance certificates for them. Now, with a paltry sum of 1,500 cedis, officials are able to forge tax records for newly created companies without any evidence of work. Absolutely no evidence of work. Joy News Kwetenate has more in the following report.
I have received countless information that contractors and business owners fake tax clearance certificates so they can bid for government contracts. So I set out to verify the authenticity of this claim. I began by registering a company called Basket Ports. Barely a week after the company became official, I set out to get a tax clearance certificate, even though my company had no tax record. Before we get into the detail of how I managed to get a forged tax clearance certificate, which could pass off as authentic, the head of Domestic Tax Office, Edward Jamra, explains why a tax clearance certificate is important.
Tax clearance certificate is a compliance tool which is used by the Ghana Revenue Authority to ensure that a taxpayer who holds that has complied with his or her tax obligation.
With the explanation out of the way, I approached a Ghana Revenue Authority staff who worked with another tax officer at the Agbogloshi GRA office and was asked to pay a sum of 1,500 cedis. I told them I needed a good turnaround tax record, and they secured a tax clearance certificate covering 3 years. The certificate reads, "Provisionally not liable to tax, deposit 500 cedis. This should help the investigative team to secure a government contract with ease."
A tax certificate that has a good turnaround.
I don't get you. You said?
They need a tax certificate that has a history that have done some job. Than a zero tax certificate. Would I have to pay all at once, or,
yes,
or I can make down payment?
No.
Okay, I need to pay all at once.
No, you should be.
And if I do, how long will it take for me to get?
Let time it come.
Then maybe
for
next
now,
week.
I'll send it. I'll send it. I'll send it to them. So
then maybe next week I'll bring the money.
Monday or Tuesday to be ready.
Oh, okay.
It will all depend on you.
The certificate was prepared within 3 days.
Baby, I made a bet on only certificate.
So let's see Tuesday. So Tuesday I would have to come.
Oh, you don't need to come. If it's ready, you can memo it to me.
Okay, no problem.
Head of the Domestic Tax Office, Edward Jamra, says the practice is fraudulent. He explains why.
If it's a new company cannot. So if you have a clearance certificate for a new company,
Preliminary investigations by the GRA reveal the tax detail of tax clearance are genuine, but another fact is that they were forged. The head of the Domestic Tax Office says they will investigate further to establish the details of the individuals behind the act.
We will be happy to investigate to find out how this tax clearance certificate was issued to the company. And if it's found out that it was done fraudulently, we will use necessary sanctions to deal with the taxpayer and the tax office or the officer who issued certificate.
So although I did not qualify for a tax clearance certificate, some GRA staff have helped me circumvent the system and have put me in a good light to bid for a government contract.
And other problem too is that now because we are short of certificates, but some of the offices, they have it. Those who work on that schedule.
It is clear beating the system in Ghana comes at a price. So what is your price tag? Kwetinati's reports for Joy News.
All right, so that was Kwetinati's report put together and read by Jojo Kobna, actually. So it just shows how easily someone can fake and get a tax clearance certificate. So these tax clearance certificates are necessary to show that you've actually done some work and you have paid
your taxes,
or whatever. But then if people are able to just pay 1,500 cedis and get a tax certificate and land government contracts, when that government contract or these government contracts are supposed to be used to ensure that people who before you qualify for government contracts, you're paying taxes yourself.
Yeah.
Because we're going to be using the taxes to pay you
right back.
You're going to be doing.
It also means that we're probably not going to get an accurate amount of taxes that have been paid if you're getting, tax clearance certificates and claiming to have paid certain amounts. So then there'll be a deficit, which we won't understand. So really, it's a lot, isn't it? It's just really, I think in Ghana you can pay for anything.
Yeah.
Yeah.
And, I can imagine if we've been able to put this together. I can imagine how many companies are able to do this so easily.
And how much is being lost, how much the state is losing for this kind of thing in terms of tax generation and stuff. So, yeah.
So, this is why some people will say when the conversations come about fixing the country.
Yeah. Do we really want to fix it? Yeah. And what it will take to fix it is, again, it's quite a mammoth task, isn't it?
All right, so our next conversation, we're actually moving on. So this feature is going to be running throughout our bulletins throughout the day. So you stay tuned. We're going to bring that back. And we do apologize for some quality at some portions of the feature. But that will be corrected so that the next time we're playing it back, we're going to hear the GRA official very clearly. All right, so our next conversation has to do with mental health. And in Ghana, about 13% of the adult population is estimated to be affected by mental health disorders of varying forms. Government expenditure on mental health reflects the priority attached to the issue. So mental health gets less than 2% of the total health budget. Now, according to the World Health Organization, there is a mental health treatment gap of 98%. Meaning only 2% of people are receiving the care they need. The sector is heavily understaffed, psychiatric facilities are poorly maintained, and it is quite depressing. And you don't want to be... Mental health, for a lot of the people who happen to have mental health issues, depression is part of it.
Yeah.
So to find yourself in an environment where it is also that depressing, this makes your case.
I don't know if you've been to the Accra Psychiatric Hospital, but a few weeks ago, more like a couple of months ago, we went to the Accra Psychiatric Hospital, Daniel Dazi and I. Actually, it's been quite a while, maybe more than a few months. And it was difficult to watch. And to see, what the place looked like, no beds, and the fact that, sometimes some of the inmates sleep outside. And so when it rains, they're actually sleeping in the rain, and it really just talks about the kind of, value that we place on mental health facilities. Also, Israel, I'm wondering, in all of the 88 hospitals and the 101 this and all of that, how many of those are we actually allocating to mental health and as mental health facilities where people are treated, where people are given the chance to recuperate, rehabilitate, because it's really not just, you know, the simple hospital process.
Yeah.
So yeah.
Okay, so
that's it. But we have mental health nurse and photographer Kobe Blay. He will be walking us through a day in his life.
So he's joining us via Zoom. And good morning to you, Kobe Blay. And he's a pretty popular guy already, actually. And he takes some really great photos. And I've seen lots of your photos, Kobe. And you do great work. But this morning we're going to be talking about mental health. Apparently, you're on the night shift, so you actually have been closed, and we've caught you up and want to speak with you. Want to understand what a day. We've been talking about how depressing the situation is for mental health workers and for patients. But you tell us, you're there right now. Give us that picture of what the situation is for you. What's a day like or a night like in your life?
All right. Thank you very much for having me. And I think it's coming at the back of the Mental Health Day celebration, which was October 10th. And quite worrying as it is, considering how mental health is of an issue, but it always have to take a day for us to recognize the issue as it is. For me, on a typical day on duty, and just like other colleagues, you do almost 3 or 4 category of activities. One of them is psychological, one of them is physical, one of them is psychosocial. I mean, it's a combination of psychology and the social life of the person. So much as people think or have an idea that or perception that in the mental facility, all you do is give injections and tie patients, and there's always aggression, there's always fighting. Absolutely, that is not the case. This morning, like this, I had a reading session with some of my clients who are on admission, and we picked up a book and read some chapters and discussed it, and some were sharing their opinions about it and all that. Sometimes we listen to the news together to understand what's happening. They share their opinions, and all these kind of interaction help us to understand the psychology of the person, the social life of the person. So in case Israel happens to be admitted on any of our wards, Israel is already troubled, and he's already disturbed that he's missing work. How can you make sure that you bring work to wherever Israel is and be able to get Israel to feel okay? Because he's already troubled and he's already missing out on what he does best. How can you make sure that whilst he's taking his care, he's able to enjoy his or her stay? So it runs through a lot of activities. It could be physical. Sometimes the person is physically ill or so depressed that they can't fend for themselves, they can't eat, they can't bath for themselves. You have to sometimes provide them with bed bath or take them to the bathroom and bath them thoroughly. And sometimes you have to feed them. Sometimes you have to do special procedures for them, which is usually recommended by the doctor. So it's a varied activity of things. It's not one straight jacket, and it's quite an interesting field to always practice in.
Now, what got you into mental health practice in the first place? I'm sure you knew before you got into it that it's quite a depressing area to work in.
I think I was first labeled. So in my choice.
No, you were first labeled as in.
Yeah. So when I saw mental health, I was wondering, what is mental health? I'm interested. Then a relative said, "Oh, ube up down for nurse." So I was like, okay, then let me just go and see how it is like. But I think one of the awakening was when I visited Ankafo. I was already schooling in Cape Coast. Then I went to Ankafo to visit a friend. Actually, I have lived in Ankafo when I was growing up. So I was like paying a visit to where I grew up at. And then I went to see the hospital. Then I went to see the facility. And it felt so awkward. I was like, how could people look so abandoned? How could they look so dejected when they are going through, or when they are already vulnerable, when they are going through such a problem? So I left wherever I was schooling then. I was in one of the university. Then I left, reapplied for that, for the mental health training school. Then I went there, got into it. And since then, it's been like 12, 13 years now, and I've been practicing, and it's interesting. I don't think there's any interesting field like mental health.
All right, so we'll come back to you to get to learn a bit more about your profession and the practice. But we've also been joined in the studio by clinical psychologist Seth Asafo,
who we've been happily terrorizing on Zoom. But today he's in the studio for the first time. Well, with us anyway. So, yeah, so great stuff. Go ahead, Nizo.
All right, so we're happy to have you in the studio. Good morning to you.
I'm glad to be here.
Okay.
Yes.
So, yes, we've been talking, apparently it turns out that about 13% of us, who knows?
I'm surprised it's not more.
It's either myself or anyone.
It's
or
definitely
both of us.
me. I don't know, but it's definitely me.
Or both of us. Who'd have some?
We'll sort you out.
You will?
Oh, yes. We have to.
Hi, Seth.
Oh, and that's Kobe.
Yeah.
We're in the same department, actually.
Oh, okay.
Yes, we're in the same department. Department of Psychiatry, Kolibu Teaching Hospital.
Oh, okay.
Yes, so we are.
So he is not at the psychiatric. You guys are not at the psychiatric hospital.
No,
Accra psychiatric hospital.
Yeah.
No, they're in Kolibu.
Exactly.
Yeah.
Oh. Okay, but what's the? I get the feeling that where we find Kobe Blaze sitting looks like a pretty decent place. But if we should go to the Accra Psychiatric Hospital, it will be...
Not entirely.
Okay, you tell me.
Not entirely. So, you see, the reality is Accra Psychiatry was built as an asylum and not as a psychiatric hospital as compared to Ankaful and Pantine.
Okay.
So you'll see that the hospital feel is created in Ankaful, is created in Pantine, but Accra Psychiatry has had to adapt from what they had. Now, beyond that, they've made several progress in renovations and, trying to make it as decent as possible. It's nowhere near the world standard, but we need to make do with what we have so far. Because if you look at the world statistics on mental health infrastructure and also human resource, we are falling short. And it's not just Ghana. It's a global problem.
Okay.
Yes.
So you're
Is it a global problem, though? And the reason I'm asking this is that I lived in the UK for a few years, and as part of my training, I did the rounds at a few mental health facilities, and it's not a global problem. I mean, for example, in the UK, yes, there's definitely shortage everywhere on some level. But the facilities are decked out. The psychologists are available. The nurses are available. There's one-to-one care for those who need it. There's rehabilitation. There's reintegration into the community. They're miles and miles and miles ahead. There are definitely no mad people, mad in quotation marks, and people on the streets. So is it really a global problem? Is it more of an African problem?
There's another aspect of it which has to do with the cultural, dynamics of what mental illness or mental health is within our context. As a mental health professional, I've been stigmatized against a lot, but I really don't care. I enjoy what I do so much. It's so fulfilling.
What do people say?
When they call you a down for a doctor, that's stigmatizing.
Wow.
Mad people's doctor. That's the typical. But you see, mental health goes beyond mental illness.
Of course.
And I guess that's where the education has to come in more, for people to understand that the way you feel is part of mental health.
Yeah.
And of course, to also understand that mental health is a continuum. It's when you are short of, when the speedometer is out, that's when you get into mental illness.
Okay.
Yeah.
So you can wake up one day and you're not feeling your best self.
Yeah, you're not feeling like going to the gym, for instance, to exercise.
So there's a lack of motivation. That could be an underpinning of mental.
Happens to anyone a lot of the time, right?
Yes, it does.
Everybody.
But before you continue, and yes. I find that we tend to do this a lot in conversation sometimes. We move from the mental illness to the mental well-being because I think it's more palatable. But I really want us to talk about mental illness. So the bipolar, the paranoid schizophrenia, and all of that. And the fact that, one, I want us to talk about the fact that we spiritualize these things a lot.
Yes.
So if you can address that, you know, whether there is a spiritual component or whether, you know, it's really a thing about hormones, the way we treat people who have these diseases, you know, is there treatment available? Are there cures? Can people be fine? And then when we finish with that, we can come to the mental well-being, which I think Ghanaians are more open to accepting as opposed to the illness.
So you see, like I was saying earlier, mental illness is when you're having a dysfunction in either the way you think, the way you feel, and the way you behave. You see, and these three components, many people only look at it from the thinking perspective. So when everyone has mental health challenge, they say the brain has been affected, okay? But the way you feel is equally important. And I'm putting it together, even though I'm going to address all your questions, I want to bring this out so people can see the dynamic, because when we focus too much on the mad person on the street, for lack of a better word, we then create narratives of mental health which are problematic.
Okay.
Now, you can't have a culture and then your health systems go beyond the culture. It won't work. And I have worked in mental health research, especially with religious research, since 2012. So that's about 9 years. And our job had to do it. We go into prayer camps. We offer treatment, medication, psychosocial support, and what we call psychoeducation to people. And we've treated a great number of people. If you look at the mental health law, one of the reasons why the WHO has put out Ghana's mental health law as outstanding is because they are incorporating traditional means of therapy as part of mental health law.
They're also charging people who try to commit suicide as a crime.
Well, that's something that, recently, a couple of months ago, someone took it to the Supreme Court to challenge that. And of course, yes, it's a dynamic, but it all goes to explain the kind of notions that people have. Of course, a lack of understanding of what mental health and mental illness is all about. Now, in working with people in prayer camps, etc., of course, the predominant view or the notion of etiology of mental illness is that it's spiritual. And in our research, we have come to find that there are people who can prove that it is true.
Really?
For example, among the Anglos, there is a custom that if a woman should cheat on the husband,
she'll go mad.
She'll go mad.
Yeah.
And this is something we have seen severally. So in our trying to develop what we call indigenous therapies to accommodate all the cultural dynamics of mental illness, we've come to notice that we cannot just walk and we can't just say we're going to put these things in the back like they do not work. Because guess what? The treatment gap, 98, means almost 98% of people aren't going to get the help. Now, they will go to these people regardless. So what do? We partner with these people. We don't go there assuming that we know the best. We go there to understand their methods. And we also take our methods to them. So in one of the prayer camps we went to, they had their own methods. We took our methods. We had a collaboration. They allowed us to give medication, which they typically wouldn't do because they believe that it has spiritual etiology. Now, at some point, they came to say that, even beyond the spiritual, there's a physical component that you should take care of. And what that did was, every time they had somebody new who perhaps was aggressive or agitated, they'd actually call us to say, we have somebody can you come and calm the person down? So instead of chaining, we now started to do what?
Okay.
Chemical restrictions, as it were. So you see, it's a long road. We're not there yet. We don't have all the people. Look, if you empty one prayer camp, there's no way that perhaps any of our psychiatric facilities will be able to accommodate all. I'm not justifying that it's important, but I'm saying that we have to take a very calculated approach to be able to provide the best care. And don't forget that in the setting of that in that spiritual setting, people actually feel a sense of calm.
Yeah, of course.
And that calm in itself is good for the mental health. If their rights won't be violated, it's something that we want to encourage.
Okay, so how do you feel about the budget, the amount of money that's actually allocated to your sector? Like, let's start from that point. Does it actually mean anything, the amount of money that you get?
I think it's grossly inadequate. But yes, you can argue, and they will argue. But I can give you a number of statistics of why perhaps we will need more funding. So if you look at the total budget, we just have 1.4% of the total budget going into mental health. Now, in many researches that have been conducted in the past couple of years, they notice one thing. For every 1 cedi investment you make into mental health, the return on investment for depression alone is 7 cedis. So if I put $1 million, I'm going to get $7 million in return.
Because a lot of people are walking out around depressed, so you're not getting the productivity are not.
Oh, yes.
I mean, if you break it down for us so that we know exactly why, the return is so high if you're investing.
Well, in one very phenomenal study by Professor Angelo Furiata, they came to estimate that Ghana loses about 7% of its GDP. Sorry.
GPA.
Academics and, GDP to mental health related conditions. And that, in comparison to malaria, is just 4%.
Wow.
Exactly.
So we lose more to mental health
than to malaria. So you can imagine what we're losing. Because look at it this way. If I have a mental health challenge, the number of days I perhaps may not go to work in itself is one problem.
When I go to work, how productive am I?
Making mistakes that may perhaps set the organization or the institution back are all part of the things that we're looking at. If you put 1 cedi into anxiety disorders, which I think are grossly underestimated, many people walk around with anxiety disorders. Yeah. We're always thinking about tomorrow. What will happen tomorrow? Would I be able to? And it gets chronic. And what these things do is they basically tip your body's sense of balance. They tip it out of control, because every time you start to think about tomorrow and you feel that you're unable to deal with it, the mind interprets it as danger and starts to pack resources to face some danger which does not exist. So how does it feel like if you start your engine and you put your leg on the pedal and then you just leave your leg there? At some point in time, the engine is going to just say, I'm tired. Yeah. So that's kind of the analogy of what is happening when it comes to mental health. And then when it comes to the psychotic disorders, so we call them psychotic disorders, but what people would normally categorize as mad. For every cedi, you get 2 in return. So put 1 million and then you get how much? 2 million. Yeah. Now, imagine that we're investing so much into mental health. The returns on investment will directly feed productivity, which means that there'll be better quality of life for the person, for the institution, and for the state. And then you can also translate that to the world.
Yeah, I bet we're not looking at it that way. But let me bring in Kobibile. He's been on the line for a while now. Okay, so we've lost Kobibile, but we'll bring him back, because I would want to understand how the lack of investment in the sector impacts the work that you do.
Good. So mental health care, I would say, is not cheap, which is a fact. There are many investigations that we do which are largely very expensive. Our sessions are typically not like the traditional GP practice. So, you go and see your GP, 15 minutes, you're done.
Also, a lot of the insurance companies don't cover.
Yes, they don't.
Yeah.
Yes, they don't. Even our national health insurance doesn't cover mental health. So the way around it is to use that to do investigations which are medical in nature, to as it were, cut down the cost. Now, in mental health therapy or treatment, it's not a one-off thing.
No, it's not.
So in malaria, you see your doctor, they treat you and it's
blood
gone.
Test,
In mental health, you have to do it consistently.
Hours and hours and hours.
I typically, as a clinical psychologist, will spend not less than an hour with each of my clients. So think about it in a day. If I have 14 clients, what happens to me? I'm probably not going to be able to meet everybody.
And I bet there are not enough of you, actually.
We are still working on that. We're still working on that. So when all these factors come to play, then you recognize why perhaps mental health seems the way it is. Look, there are too many myths about mental health and mental illness, which are wrong, and I think the education must go out there. For example, one of the most significant myths I tell people about is that mental health people are not aggressive, which is something most people believe.
Yeah, because you see people who, and you call them psychotic.
Yes.
People who are going through the psychosis, you see them, act out, shout, yell, scream, things like the aliens are coming and stuff like that.
They'll get aggressive because you don't believe them.
Yeah.
I can see something, you cannot see it, and I say I'm seeing something, and you say you are lying. How am I supposed to feel about that?
Yeah.
But I understand the symptomatology of psychosis. So if the person says I can see something, basically what I do is to say, tell me more about it.
Okay.
And in so doing, they become more accepting of me because I understand them, is the way they see it.
Oh, they think you see it too.
But I am picking up all those symptoms that are necessary for putting out the right intervention for them to get better.
Okay, so still comes to the issue.
Wow.
How is that lack of investment impacting the work that you do, or disabling you from doing your work?
So it breaks the consistency of therapy, which I was mentioning, that our job requires consistent visit to your practitioner. So if you have a psychiatric disorder and you're on medication, at least you see your psychiatrist once a month,
okay, until
you get better. For your psychologist, you may probably be seeing them twice a week or once a week. So if you take a typical government facility where you're paying about a minimum of 100 cedis per session or per consultation, that's 1,200 a year. And if you're doing with your psychologist, that's about 400 a month times 10, 8. And that's all a lot of money. Now, in many advanced countries, because mental health care is taken care of by insurance and some government subsidies, etc., it allows people to continue with care. But we have a lot of discontinuation of care. And also, when medications are so expensive, like with one of our medications, for instance, the initial dosing alone is over 2,000 cedis. So you can think about all of these things. How many people are likely to be able to afford it? Not forgetting that anybody can suffer a mental health condition. And if you look at the per capita income for citizens in our country, then it means that a whole lot of people will not be able to afford mental health care. Now, because of the scarcity of professionals also, the private practices are equally very expensive.
Yeah.
So you're caught between a rock and a hard place. But if more investment were made, it would translate not only into the individual clients, but into the professionals who go into this field. We're going to have more of them if we have more investment going there for scholarships for people to be able to pursue these courses and bring these skills back. Then we'd be bridging the gap gradually. I mean, we have a doctor-patient ratio of 1 to about 800,000 when it comes to psychologists.
Wow.
As compared to the US, which is 1 to 74.
Okay.
So imagine, and the load on us, you break down yourself as a professional. So the reality is the continuity of care that is usually not there means that people don't get better well. They don't get fully, their conditions don't get fully resolved because they'll start off, at some point, I can't deal with the finances. Or even if you have somebody who's taking care of the finances, they get tired and say, then I'm not going to do this again. And they just stop. And of course, when people start to feel a little better, the tendency for them to feel all is well is also high because they're also counting the CDs in their pocket.
To spend.
Exactly. So all these investments will help in infrastructure. I heard you talk about rehabilitation. Mm-hmm. We are doing well.
Are we?
We're just not there.
Okay.
Are you being optimistic? No, wait, because
sounding
very... No, because we've spoken to Seth a few times, yes. And I remember that one of his mantra thingy says, you have to be optimistic. You have to look at the bright side.
Yes.
Are you looking at the bright side? Or are you
it sounds like that's what you're doing. So by doing that, you're like in some denial of a sort.
Not at all. Look at it this way. If you look at how within let me say, the past decade, the improvements that mental health has gained is quite significant. And we're moving very fast as compared to maybe 20, 30 years ago.
Really?
Then, Ghana had 3 psychiatrists. Then, in the past 10 years, we have specialist psychiatrists, we have over at least 15 or 16, which is significant. Psychologists have increased significantly. Like Kolebu, for instance, has hired 15 psychologists to do liaison psychiatry with different institutions. Before, Kolebu used those of us in the medical school. So we're lecturers to the medical school, we're clinical psychologists. And so Kolebu used those psychologists to provide services to the whole of Kolebu. So we are progressing. Now, Pantine has its own drug rehab center. Accra Psychiatry recently opened the Serenity Rehab Center. So this is 2 within just a decade. Not forgetting how many private rehabilitation centers have been opened in the country.
Okay.
I can name at least 7 of them. Of course, it's not cheap, but it's there. So it tells you that gradually we're progressing. No, this is not even gradual. We are progressing very well. The amount of buy-in from the media, I mean, now you're always going to get someone talk about mental health in some aspects. So we're making significant strides is what I'm saying. If we keep up this flame, maybe in the next 10 years, we should be saying that, we are marching up to the world standards, as it were.
Okay, so I hear you talk about personnel and the fact that we're improving the number of professionals, practitioners who are in the field. But you happen to work at Kolebu and
Yes.
understand. Do you ever get to work in any of the psychiatric facilities?
Of course. So especially for me, because I'm a lecturer with the medical school, as part of medical school training, when they do their rotations in psychiatry, I have to physically be in either Accra Psychiatry or Pantine to take students through that. And during that time, you offer care for people who are available as well. So yes, I have worked in all these institutions. Perhaps it's only Anchorfold that I haven't been to.
Okay. And what is the situation in these facilities? Because I feel Kolebu seems like the posh place where you're handling things and you don't really get to, come into contact with what the situation is on the ground at these psychiatric hospitals where we're hearing they're underfunded, they're depressing to look at and all of that.
It's the same everywhere. I've forgotten the year specifically. Mental health care was primarily free in Ghana, even though government wasn't putting out the funds. So at a point, Accra Psychiatry went on strike, and they started to charge for the services. And since then, things have got it better. Look, in terms of conditions that we experience, with the clients we encounter or interact with, we say they are the same across board. It doesn't really matter. Maybe the Kolebu ward is a bit posher because it's recent.
Okay.
And because it's within...
So let's agree that it's posher.
Oh yes, that I agree with.
Okay.
It's posher.
A little posher.
Sadly, that ward can take more than, I think it's not even more than 14 people at a time. So we just say it's a brief observation unit.
Okay.
They typically do not want to take people for too long. It's just like pass through, get quick therapy, get stabilized, and then you go. So the outpatient unit of the community psychiatric nurses do the follow-ups.
Okay.
To homes to provide their medication and psychoeducation, etc.
So you don't run a place like the Accra Psychiatry where you describe it as an asylum?
You won't have someone in Kolebu for the number of years that people would stay in Accra Psychiatry. Typically, we haven't had such instances.
Okay. Let me bring in Kobe Blay. Kobe Blay was off for a while. So, Kobe, we're talking about the situation in most of these psychiatric hospitals. Now, he's being very optimistic here, and he likes to
completely.
He says, it's not so bad.
It's not too bad. We've made strides.
What is your story? What would you say about the mental health sector and the challenges you're facing in that sector? Are you that optimistic?
I think I would equally be optimistic. I mean, by virtue of my profession, I have to be.
Okay. So now, here's where we get it. So here's
so it's by virtue, okay.
By virtue of your profession, you like to be optimistic.
Have to be positive. But the reality of the matter is, it's just lip service and nothing else. We want to see to be associated with the vulnerable community, and we never are doing much that we have always said or we are always saying elsewhere that we are doing. And the mental health space has been left to CSOs and NGOs running, in quotes, their own business because they have the money. And we have established an authority that is not funded until an NGO or a project is coming before they get some monies to pursue a certain program. So the problem starts with the mental health authority, which is not having the capacity to be able to manage the sector as it was programmed to be. So you realize that there was supposed to be some funding to the mental health authority, but today if you go there, I'm not sure they do have anything like that. So you realize that it is able to run programs based on projects that they receive maybe from the international community or from some CSOs. So that is what is happening. So when you come to institutions like Kolebu and you find out that the wards and things look better, it is not by virtue of anybody anywhere bringing in support or funds to get things done. I have worked, like I said, in the other hospitals, and my last hospital was the Accra Psychiatric Hospital, where in maybe a ward like the special ward, I had patients over 200, over 300. The hospital had over 700 patients who have stayed there for long. But the idea of the Kolebu one that we are running now was to make it more easier for people to come, not stigmatized, and be easily reintegrated into their communities. So we are not even calling it the psychiatric ward. We are calling it brief assessment. Yeah. Imagine someone finds you standing in front of Accra Psychiatric Hospital, and someone finds you standing in front of Kolebu Teaching Hospital. That there are different stigmas that are going to play out. So it is equally important for us to also reintegrate this mental health care in the general health facilities. So the question that I think the lady asked was about whether the new hospitals has any of these mental health or psychiatric departments factored into it. I don't know, but that is what is happening. We've paid a lot of lip service. We have left the mental health space into the hands of developmental partners and CSOs and private institutions trying to make it work. But when you look at the central figure that is supposed to be the midfielder and making sure that everything goes well, not much has been done. When you go to the training of personnel, my institution and the another one, which is in Pantine, has remained the only training institution for mental health nurses. None have we heard coming up from anywhere. So you realize that even the professionals are limited. You have professionals who are trained in mental health, and that's all. At least we should go forward to have specialties in mental health, geriatrics, mental health forensics, mental health, child and teenage and adolescent health. I mean, those areas should apply because you can't use one area, one environment to fit all the conditions. That is not possible. So yes, I am optimistic, but no, the reality on the ground is we have paid continuous lip service and allowed virtually the developmental partners and the few CSOs trying to rather run the game of mental health. And the central players are stifled, because they don't have what they have to work with.
Okay, Kobe, so if, let's say, we dedicated a lot more to the mental health sector, so you had enough money, we had enough facilities, maybe even put mental health care on the NHIS, how much of a difference would it make? Because one of the things that we have found in our reporting is that a lot of people are not convinced that mental health issues can be managed, maybe not cured, but managed, you know. So how much of a difference would it make if we paid a little bit more attention to it? Not the optimistic kind of, you know, 15 you know, psychologists over 10 years, but, you know, real proper one psychologist to 74 people, you know, kind of levels.
So for example, my facility, I mean, where I and Seth both are, and he clearly talked about even our limited space and our bed capacity. So if there is enough money, meaning that we could have enough space. If there is enough money, meaning that we could train more professionals. If there is enough money, meaning that medications and special therapies will be available. If there is someone who needs a sleep therapy, we know that there's a sleep therapist who is going to be available. We have space for sleep therapy treatment. If there is, disease, drug addiction, we know there is space for it. Previously, we had a drug therapy unit, and it was an eyesore. It was more like a carpenter's shop, like a wooden structure. And imagine you have someone who have gone through drugs and substance abuse, and you bring the person to such an environment for treatment. What exactly are you expecting? But then again, when some people have abdominal pains, eye problem, we know the kind of facilities they have to be treated. When people have a fracture of the leg and all that, we know the kind of theaters and all that have to be given for them. Unfortunately, we have varied therapies in the mental health area. Can we even admit a person in the hospital and even go on a ground parole? Can you stroll around? What kind of environment are you strolling the person around with for him to see the beauty of the nature environment he is? So yes, there are therapies and there are various kind of treatment that are available for them. But then again, there's limited space.
Okay.
In Kolebu, we have a lot of psychologists that are even able to fill other departments. But when you come to our department, we could have taken more, but there is not enough space even for them. Even the space for our OPD is very limited.
Okay. I think Seth wants to say something as well.
You see, first of all, I want to talk about the optimism. The optimism is not forced or foolhardy. It is simple. We are not getting funding, and we're still making these strides. So if we get funding, then what happens?
Okay.
We'll do more. So that's one aspect. See, the notion that many people have about mental health challenges, they're not curable, medications give side effects, etc., they still stem back to the issue of funding. If you start on psychiatric medication, you need constant review. For instance, to treat malaria, everybody knows there's one malaria pill, okay? To treat some psychosis, you have several antipsychotic medications, and everybody has a different neurochemistry. So this may not work very well with you.
Yeah.
And so you need that consistent review or management process for them to find what works best for you, for them to find let me say, the optimal dosage for you, etc. And all of these things takes money. It takes time. Now, imagine that in Kolebu, we don't even have, there are times where the consulting rooms, you have doctors, but we don't have consulting rooms. So that's all wasting the time of patients who are coming to get the care. And what can they do about it? They can't do much. They're doing the best they can. The conference room, etc., have been turned with blinds to, accommodate people. But you see, mental health care requires a lot of privacy. And that privacy is not there. And it falls back to the stigma. Now, if you look at the general perception of people, mental health care is stigmatized because people just don't understand it that much. And for the people who are in the helm of affairs, perhaps their own mindsets of what mental health issues are is part of the reason why we are not getting people to champion the cause of mental health. Because it seems like, once you get it, you are gone. I can tell you on authority, the clients I have, maybe some of them are your doctors. And they are well. Because they can afford it. They are consistent with therapy. They are consistent with medication. And they are doing awesome. So everybody is capable.
I want to ask, sorry, Ezra, just before, I want to ask psychology from the tertiary institutions. The what's it called? The notion, the perception that it's not as important. It's not as, I'll give you an example. When I moved back to Ghana, I applied because I wanted to study that here. I wanted to top up. And when I applied to the University of Ghana, they actually sent me a letter and admitted me into the University of Ghana Business School and said I was qualified enough for that. So they weren't too sure why I had applied for this.
Okay.
Yes, I still have, I mean, I think maybe somebody made that decision, you know, that, oh, you know, maybe this girl doesn't really know what she wants, so why don't we, you know, offer her something better? Yes, very interesting, isn't it? It wasn't even part of my 3 choices, the University of Ghana Business School. But anyway, but you find that, and so I was intrigued. So I asked, you know, some of the students, you know, around at that time about the perception of them choosing that as their degree or as their major, you know, and it was just like, you know, yeah, well, you know, we chose this, maybe we didn't do too well, so, you know, they gave us this, you know, they did, you know, and is the problem, does it really stem from that point where 17, 18, 19, 20-year-olds are being told that this is not really even something that is of that much value?
Palatable.
Exactly. Do you get what I'm saying?
I do,
right?
I
Yeah.
do.
Okay.
And you see, I think all these things is part of the reason why we need more mental health advocacy. Now, among many of the international schools, they have mental health awareness things they do. Okay, and they invite us consistently to give, even in their career fairs, etc., etc. So basically, someone is able to understand the process. Now, you see, many people tend to look at the social sciences as an easy way out, so, and they give expressions like "yeah, they." So I also want to get a degree.
So I'm just gonna
exactly, which is just a mindset. But with many people who are interacting directly with the professionals in the field, their notions are changed. I'll give you an example. In Kolebu, we always have national service people pass through our department. Guess what? As soon as they're done with national service, they apply for the master's in psychology. Why? Because they see it working practically. They can see it and feel what it's like. And that's the kind of education that we need to teach, the practical aspect of the field. Yes, in Ghana, with the first degree in psychology, you might not be able to do much because it's quite a specialized course.
It is.
But with initiatives like what we call the PsyCorp, which is psychology graduates, they're given an orientation, joint program between the University of Ghana Medical School and Yale. And what they do is they're posted to the fields to act as lay counselors. Now, we're also getting a lot more of these people trying to go in for the professional aspect, which is to get a master's and then further, etc., etc. So the notion in the social sciences, it is practical, but that's because many people do not have the right information.
All right. Let's go on.
Right.
Let's go to Kobe Blay. Kobe Blay, once again, I want to come to you. Knowing the challenges that exist in the sector, I believe that it's important that we, as citizens and members of the public, should know a few things that should keep us healthy when it comes to mentally healthy, so that we don't find ourselves having to come to depend on the very meager resources of the state when it comes to mental health.
I mean, thanks so much. I really would have loved to take.
He will come in. He will come in, but he's been speaking for a while, so I thought I should bring you in.
So, but let me add something more to what said before I jump up. Now, one other thing that we are doing with our institution is having a bit more community focus with what we do. So, as part of Mental Health Day celebration, we went into the community to engage, interact with the various communities just around us, especially Kolegono. And we interacted with people, went into their homes, the staff went into their homes, and also screened for those who are interested or who wanted to be seen. Now you realize that most of the issue that they had to face had to do with stigma, and the fact that if they come forward, they will be associated with what we call madness or something. So it is high time that we are also mindful in our conversations, our media activities, how we sort of brand mental health, in the sense that certain language, certain words, certain terminologies could be avoided or polished in a way that we can help people to take up the care. I mean, that is one of the things to even clear up the way that people can easily assess mental health and they can be seen.
What are what are some of the words you want us to polish?
Mad.
So, for example, you call someone the schizophrenic. He's schizophrenic. He's bipolar. He's yeah. So it's like you are not a person anymore. Immediately you are diagnosed, but you were a person before you are diagnosed with mental illness or anything of that sort. So a person living with, or a person diagnosed with, or a person this.
All right.
Why don't we say he's a stomach ulcer, but we say he has stomach ulcer?
Okay.
All right. So we are sort of personalized. We are making people become the diagnosis. We are socially diagnosing people. So because the person talks too much, because the person interacts a certain way with others, we already diagnosing people and calling them by their diagnosis, which is so wrong. So we have to identify that people are people first before their diagnosis.
All right. So then it comes back to the issue, the question I was asking, what are some of the red flags we should be looking out for?
One of the things we need to look out for in cases of maybe someone developing possible mental health condition is one, who was this person and what different has become of him? For example, was he very social and has he now been withdrawn for quite a while? Was he very interactive and nice and all of a sudden he's becoming quite irritable to everything? Is he avoiding the very things he used to do and find joy in it? So if for some time you don't even find Kobe Blay even taking photos or doing photography, it may not be Sikasem or what. Maybe the person is not finding fulfillment with the work he's doing or has encountered a situation that is making him feel depressed and wants to just forfeit it. So we should look out for some of these things. Someone had interest in a certain thing or some activities, and all of a sudden they are beginning to stop. We have stopped. And when you look at their personal hygiene, when you look at the kind of conversation they are holding, the language they use, you should show concern. Now, you should not immediately go by tagging the person, I think you are mentally ill, but probably just a matter of showing consent to it. So social isolation, social withdrawal, the person is avoiding the activities he used to do and find interest. Even the thoughts that he expresses, does he not find life worthwhile to live? Is he talking so much about death? Has he expressed any idea about killing himself? Or that it is important for us to look out for some of these things, because very often we don't take closer look at it, it becomes worse.
Right. So then I'm sure you also have quite a lot to add to it.
Yeah. I mean, to summarize all that Kobe said, the reality is sudden changes in the person, okay? And also we're looking for a degree of impairment that they are somehow limited or restricted in being able to do the things that they previously were able to do. And of course, in our part of the world, we judge it using the agents of socialization, work, school, church, and then family life. So if you're experiencing these changes, someone has suddenly changed. Of course, there are a number of other symptoms that are very classic, like we look at sleep. Either sleep patterns are modified, they're sleeping excessively, or they're not being able to sleep.
But this is outside of a certain bracket, isn't it? Because I'm saying that because there are things that happen to us in life. And so change in those seasons would be normal. So for example, if you just lost someone you love, of course you're going to, have these changes. Doesn't mean that automatically, your mental health is impaired.
Good. So we use the context also
Context is the word.
Explain a lot of things. Now, I expect that if somebody loses a loved one, they'll grieve, which is usual. But if after a year they are still grieving, that's becoming problematic.
Okay.
Because we know that with grief, with time, you should get better. So if with time that's not happening, we are worried. Take the anxiety of starting a new job. You're afraid about starting a new job. It's fine. You wonder if it would be what you always
the best decision if you can.
But if you start working and every single day becomes a hassle, you have to mentally affirm to be at the office. That's becoming problematic. So those are things you're looking out for.
Okay. And then, so talking about mental health as well, and you're looking at the various professions, it turns out that they say journalists are quite predisposed to mental ailment because of their
reportage,
the things they encounter.
Yes.
Doesn't that then mean that we probably should come to multimedia friends and volunteer sometime and come and check as well?
It also means that maybe multimedia should also invest in mental health. Because in a profession, for a profession, you know, where there's so much, you know, I think
we're doing barter.
It's unfair. No, we don't want barter. We want money. We want money. I'm talking for you. No, because I'm very passionate about it, especially because we want money so that we can build beds, get medication, you know, pay the mental health workers well.
No, as you come.
So no.
Then we also get to interact with you. We talk a lot more about mental health.
No.
But that's
workplace.
That should be part of your corporate social responsibility.
Exactly. So maybe companies should, you know, make it important for them that they care about the mental well-being of their staff and pay for it. Because productivity, when I'm fine, you know me, when I'm fine and I come to work, I come to work. When I'm having a bad day and I come to work, I don't come to work. Who loses?
See, interesting that you would mention, but tomorrow, as part of the World Mental Health Day celebrations, there's a summit on incorporating like what we call employee assistance programs into institutions. So that's on EAP Africa. Anybody who's interested can just go to their social media handles and register. It's an online event. And of course, institutions are beginning to see the importance of mental health. From where I stand, should not be a practice where we do curative medicine. We should do preventive. So basically, educations like this, you have no idea how it's been awesome for some people. And they suddenly realize all the spots in their life that perhaps were unsettling them. You see, you asked the question about what can we do to protect or safeguard or enhance our mental health. And I normally talk about the free ones first.
Okay.
There are some that everybody is capable of. Number one is sleep. You see, there's a reason that many researchers on sleep would say that you need 7 to 8 hours of sleep every night. And I try and break it down as non-technically as I can. Within every 90 minutes of sleep, you complete one cycle of sleep.
Every 90
minutes. Okay, you complete one cycle. And in that cycle, so many things happen. Prominent among that is the release of what we call oxytocin, which people call the love hormone, the bonding hormone, the happy hormone. Now, a more positive mood generally boosts your immune system, which means that you're more resilient to viruses and bacteria and blah, blah, blah. So during COVID, we kept on saying, do things that are fun, because that positive mood actually boosts your immune system. Now, if you're in a state of anxiety or sadness, your immune system is suppressed because the mind explains it as danger. And if it thinks about danger, it's thinking about like a gun to your head or a knife to your chest. So it's going to say, at this point, we don't need any internal soldiers to fight bacteria because we are about to die. Then it turns off that system, the immune system, and say, you go off for some time. So notice this, when people go through a lot of stress, the next thing is that they fall ill.
They fall sick, You
go and write an exam. Before the exam, you're under high pressure.
And you start catching like a cold or,
Exactly, because your immune system has been suppressed. So sleep, which is that 90 minutes, gives you one dose. Let me use the word dose of oxytocin. Now, what it means is, if you sleep for 3 hours, you're getting 2 doses. If you sleep for 4 hours, you are not getting 3 doses. You are getting 2 per. You need to complete the cycles.
Okay.
So if you get an optimum level of 8 hours of sleep, that's about 5 doses. And you wake up in a much better mood. And you're able to reason more, you're able to be more productive because concentration and everything is intact. So sleep is one of the best ways to protect your mental health. At the same time, during the day, you learn so many things. When you sleep, these things are consolidated in the foundation of your memory. So if you want to actually remember, you should be sleeping. You study, you sleep, and then you write an exam or you do whatever you're supposed to do. So free tip number 1 is sleep. Free tip number 2 is exercise. if you look at many health, public health messages, they talk about exercise because exercise is good for the physical being and for the mental health. It's good for physical health and for mental health. Now think about it this way. The mind works in a very interesting way. When you think something, it almost starts to play out or it becomes real. So if I start to wonder about, will I be able to pay my rent in 2 months? Even though my rent is not due, I start to feel what it would be like if I'm unable to pay my rent.
Yeah, okay. Like today, the landlord is collect, yeah.
Beautiful. And it happens to a dozen of people because basically they're in the future and they have no control over the future and they are trying to control what they cannot control, which is further depleting their resources. Now, when you're exercising, apart from the physiological benefits of the release of endorphins, etc., you can't be exercising and be thinking.
Okay.
So, by so doing in exercising, you're turning off what we call your alarm system because you're focused on something.
Something, okay.
It's just like taking a vacation. Taking a vacation works this way. If you go into a new setting, your mind is likely to register all the new things and forget the things that you are used to.
Which is why I'm enjoying my life right now. Can we just go to the third one really quickly because we're running out of time?
And the third one is always form social connections. Okay, there's a shared responsibility that we have. I may be going through a problem and think that it's limited to me, only to talk to someone and realize that I'm not alone. Yeah. Now, humans tend to personalize and also limit the things or events that occur in our lives to think that we're the only ones. And when we start to ask questions, why me? Why me? Why me? It further boxes us down and makes us feel like there's something about us perhaps why we are not doing so well. So these ones are free and they're in the control of everybody.
The rest will cost you about 250 Ghana cedis an hour. If you want more information. Thank you so much for joining us. There's so much more that we could do, but we're running out of time. Okay, guys, so we're going to take a quick break.
Well, and thank you to Kobe Blay. Kobe Blay has...
Of course, Kobe.
Kobe, I see on your lab coat or whatever it is, that it's Kelvin Odonko, right? That's your name.
That's my name. Yes. Payslip name.
That's his payslip name. Thank you so much for joining us, Kobe, and all the best to you. And we're taking a quick break, and when we come back, of course, we have so much more. This is still the AM show.